kills more people than all other cancers combined. Well, while we routinely screen to detect cancer at the earliest, most treatable stage, we don't routinely screen early for heart disease. As Andrea Rohn tells us, there is a test that can do that, and it takes less than 5 minutes.
Knowing your numbers when it comes to diabetes, cholesterol, and hypertension are good indicators of your risk for cardiovascular disease. But of the 1 million people who turn up at the ER annually experiencing a heart attack, 55% of them have had no underlying symptoms until that first attack.
There is this misunderstanding that if you have coronary artery disease, it must be apparent, or you must be totally out of shape, or you must be obese.
Dr. Mehrdad Ghafouri is a medical director at Inova Heart and Vascular Institute.
In order to be able to be confident if there is underlying heart disease, I think the best way is to image coronary arteries.
One imaging option is the coronary calcium scan. It's a specialized X-ray test that provides pictures of the coronary arteries. Doctors can see if they are blocked or narrowed by a plaque buildup, which would be an indicator for heart disease. For which patients should doctors prescribe this test?
My suggestion is male above age of 45 who have at least one additional risk factor, such as hypertension, diabetic, elevated cholesterol, family history of heart disease, or female above age of 55.
I'm not diabetic, I don't have a family history of heart disease, but I am the right age, and I do have one additional risk factor, hypertension. The cardiac heart scan is an easy test, and except for my underwire bra, I didn't have to undress. Michael, the CT technician, attached 3 electrodes to my chest in order to record my heart activity. Then it was into the scanner. The low-dose X-rays take pictures of my heart in between beats.
All done on it. That's it.
Not including the prep, the scan took less than 5 minutes. My test was graded on a score from 0 to 400. Above 100 means coronary artery disease is highly likely in the next 10 years.
Well, Andrea, I have great news for you.
Oh, good. I can take it.
There is no calcification of your coronary artery.
My calcium score was 0. Taking a closer look, everything in green is calcium, but it's in my bones where it should be.
You can see the ribs, your backbone, and everything shows green. And when Dr. Ghafouri going through your area of the heart, coronary, which is your RCA, your back of coronary, there's nothing in it.
What you have done throughout your life has worked for you. Your risk is very low, and hopefully this is reassuring to you and your physician who are taking care of you.
Going forward, Dr. Ghafouri prescribed a healthy diet, watching my weight, regular exercise, and keeping my blood pressure in check. At Inova Heart and Vascular Institute, Andrea Rohn, WUSA 9.
Wow, that looks like it could really save some lives.
Yeah, absolutely. Hopefully insurance will take care of it too.
Yeah, because it probably is a little pricey.
Well, you think it's probably cheaper to do that scan than it would be to be treated for cardiovascular disease down the road. So
That's
that would just kind of make
because
sense.
it's usually a long treatment.
Yeah.
All right, the internet went crazy this week after